Question 1. Which of the following conditions would lead to a prolongation of the rapid upstroke phase of the capnography curve? Bronchospasm. B. Pneumothorax. C. Pregnancy. D. Pulmonary embolism. E. Sepsis. The answer is bronchospasm. The rapid upstroke phase of the capnography curve represents the transition from inspiration to expiration and the mixing of dead space and alveolar gas. Prolongation of this phase occurs with obstruction to expiratory gas flow, for example, obstructive lung disease, bronchospasm, kinked endotracheal tube, or leaks in the breathing system. Question 2. Which of the following may lead to false negative results when capnometry is used to confirm intubation of the trachea? Bicarbonate infusion. B. Cardiac arrest. C. Chronic obstructive pulmonary disease. D. Pneumothorax. E. Pulmonary embolism. B. Cardiac arrest. Capnometry can confirm intubation of the trachea but may give false negative results in cardiac arrest if delivery of carbon dioxide from the periphery to the lungs is sufficiently diminished. Misleading end-tidal CO2 readings causing false positive results can occur with esophageal intubation after bag mask ventilation and ingestion of carbonated beverages or antacids. However, detection of EtCO2 usually ceases after 6 breaths, and if capnography is used, the tracings look abnormal. EtCO is also falsely elevated for 5 to 10 minutes after injection of sodium bicarbonate. In non-arrest settings, the EtCO2 approaches 100% sensitivity and specificity in confirming correct tube placement. Question 3. To maximize cerebral blood flow, a patient with a normal intracranial pressure who is undergoing resuscitation should be ventilated to maintain a partial pressure of carbon dioxide, PaCO2, within what range? Answer is D. 35 to 40 mm Hg. Answer D. Carbon dioxide is a potent vasoactive agent, and lowering of the PaCO2 by hyperventilation results in rapid reduction of cerebral blood flow. Because reductions in CBF reduce total cerebral blood volume, hyperventilation may transiently abort brainstem herniation in the presence of critically elevated intracranial pressure until osmotherapy or ventriculostomy can be initiated. When ICP is not elevated, however, the vasoconstriction and increased cerebrovascular resistance caused by hyperventilation can cause potentially dangerous reductions in CBF. In general, ventilation to maintain PaCO2 between 35 and 40 mm Hg is safe and appropriate. Question 4. Select the best answer. Which of the following statements is false? Early magnetic resonance imaging, MRI, and serum biomarkers have a clearly established role in determining the prognosis of patients within 48 hours after cardiac arrest. B. In a study from the Resuscitation Outcomes Consortium, median survival to hospital discharge among all patients with emergency medical services, EMS, responses for cardiac arrest was 8.4%. C. In cardiac arrest patients who survive to hospital admission, 14% to 55% have good long-term outcomes. D. The vast majority of 1-year survivors of cardiac arrest are neurologically intact. Answer: Statement A is false. The role of early imaging, neurophysiologic testing, and serum biomarkers in predicting outcome has not yet been clearly established at any time point, especially not within 48 hours.